I've given dozens of talks at UCLA and have met thousands of pre-med Bruins. I've been at UCLA myself for 8 years, 4 as a pre-med student and another 4 as a medical student. And every year, 1,200 UCLA students apply to medical school. For context, that's like competing against 4 completely full general chemistry classes. Everyone has the GPA, everyone has the MCAT, and everyone shares the same professors writing the same letters of recommendations. Now, to stand out, UCLA Premeds must have exceptional extracurricular activities. And too often, I see hospital volunteer, scribe, and volunteer director of the Do Nothing Club as a pre-med's most meaningful extracurricular activities. That was me. Generic, mediocre, and not unique. It's no surprise that I wasn't going to get into medical school that way. So today, I'll show you my favorite 7 UCLA pre-med extracurricular activities that don't suck. These stood out and got these pre-meds into medical schools like UCLA, UC San Diego, UC Irvine, and UC Riverside. All right, this is extracurricular activity number 1 from a student who is now a happy medical student at UC Irvine, soon to graduate. This is him at UCLA as a part of a clinical research position with the student stroke team. Let's read some of this together. I highlighted a couple of parts that I thought were telling. I determined stroke patient eligibility for clinical trials in the emergency department. I carefully observed stroke neurologists as they collected patient histories, symptoms, imaging, diagnoses. As I saw physicians treat patients, I gained a greater appreciation for the relationship between healthcare and research. There's this patient with Broca's aphasia and was given a medication tested in our clinical trial. Soon he was speaking normally and sustained minimal injury to his brain. Research ultimately improves patient outcomes, and I hope to integrate research into how I practice medicine as a future physician. We have next here, I was intrigued by the many stroke cases that came to the emergency department. The young woman with weakness in her left hand, the neurologist with a family history of, a patient with a neurologist, a family history of Moya disease, a rare vascular disorder, abnormal vessels in the brain. A personalized treatment plan was made for her. Experiences like this showed me that physicians do not formulaically treat patients, rather they intently listen to the story and form individualized treatment plans. Each case I saw had a unique presentation. The young man with right-sided weakness and her history of Sturge-Weber, a senior citizen who dropped his morning coffee, a grandparent who suddenly fell unconscious on his way to the airport. I appreciate how neurologists consider each patient individual circumstances and constructed personalized treatment plans. So this is all about personalized treatment plans, and I just love the specifics, right? I love the Broca's area patient, the Moya's disease, the young man who woke up with right-sided weakness, the senior citizen like grandpa and grandma who just dropped his morning coffee and suddenly couldn't speak to his wife, the grandparent who's traveling with the family and suddenly falls unconscious. We all have grandparents. We all know a senior citizen who drinks coffee on the porch reading a newspaper. This is all so very relatable, and it's the details that allow for the connection. That's why it's important to reflect and log extracurriculars as they happen, because if you remember the details, if you can share with us the specific scenarios that are relatable for us, then we can partake and participate and be a part of your story, right? I love this extracurricular at UCLA because this is all built into one club. You don't have to make anything. You don't have to join create a new organization, become the president, and recruit members and all this other stuff. No, this is an established student stroke team club at UCLA. It just goes to show that some of the clubs are just well established, have great experiences for pre-meds, and at UCLA, this is one of them. The hard part is getting into a club like this. Unfortunately, I myself applied 7 times, knowing how interesting and how the responsibilities you had as a clinical research assistant were just outstanding, amazing. I applied 7 times and didn't get in once. And so while this is not an option that's available for everyone, if you can get in, it is such a fantastic option to learn more about medicine. All right. Let's move on to 2 from my application. I'll talk about Vietnamese community health. This is something I did for all 4 years of college through different responsibilities, starting as a volunteer, then moving to a finance director, and then moving to the health site and transportation directors. So in 2006, 5 students found VCH with the phrase "Sức khỏe là vàng," or "health is gold," in mind. Since my first day at UCLA, I volunteered at quarterly health fairs and biweekly health sites to mitigate health disparities faced by the underserved Vietnamese and Hispanic communities in Orange County. Look at the details there. Very specific population of people. At our last health fair, the average income of our 150 patients was $10,000 to $30,000. 37% had no insurance. 50% spoke little to no English. 60% at risk for hypertension, 33% with abnormal blood levels, and 10% showed diabetic sugar levels. This updated health information, otherwise inaccessible to our patients, empowers them to take their own health into their own hands. I love data. I think if you're able to partake in an extracurricular activity where you can aggregate the numbers, how many patients you're seeing, who your patients are, what problems they go through, then you can really paint this very well-defined picture for medical school admissions committees. And the great thing about this club is that anyone can join. You don't need a competitive application process. You don't need to pay any money. This is just a community that was close to me and my heart and my interests. And I'm sure that you have your communities, your people, your populations, your problems that you're also interested in. And so finding a club on campus with like-minded people who are interested in similar things, that's very helpful. And this is why I ended up staying with this club over 4 years and over 400 hours developing that. With VCH, I realized that medicine is practiced in various settings. I've translated for both Vietnamese and Spanish patients, learned of their inabilities to navigate to the American healthcare system due to language, financial, and cultural barriers. I've applied for 12 funding bodies earning $21,000. Again, more data, more data, more data. By tracking how we spend this money, I've realized that medicine is found on more than just disease pathology and drugs. Trust built by volunteers who speak their languages, accessibility because there's a venue near their home, and comfort by having doctors from that practice Eastern medicine and holistic health all help them feel more comfortable. I've also learned that health is a longitudinal battle. While we inform patients of their early risk for chronic disease, our services are limited past the day of the health fair. So now I'm sharing with you a problem that we have, which is basically we see them at one point in time and then we rarely see them again. To combat this, we implemented a patient outreach committee that follows up with and refers patients to relevant services, thereby continuing their care long term. Not only has VCH confirmed my desire to become a physician, but also has added nuance as to how I want to practice medicine. I want to be culturally competent, active at the community level, and relevant in my patients' long-term care, right? So again, a couple of highlights. The data is just so objective and so powerful. 60% hypertension, 150 people with $10,000 to $30,000 of income, 12 funding bodies. I earned $21,000, right? You can say a lot more if you have the numbers to support it. And the other thing is that once you get to a point where you find an organization, a club, and a group of people that you really enjoy working with, you can see that making an impact and becoming a leader comes a little bit more naturally, right? I know the problems of the people because I'm invested in the people. I was able to apply to 12 whole funded bodies and earn $21,000 because I care about the mission, right? If it was something that I was doing just to get into medical school, it would be hard to work those late nights and write those essays and film those videos and submit them to funding bodies to support the community because I wouldn't have a real kind of innate meaning or reason to do all this. And everyone has something they're really interested in. For me, it was the Vietnamese community. For you, it might be patients with autism. For another person, it might be infectious disease and global health. And I think we are all passionate about things. And this is, in my opinion, a great example of a club anyone can join. It just has to be the right club that fits your exact interests. And if you find that match, you'll take off with those opportunities. One thing that I also want to point your attention to is even though it was something I really loved, I still was rejected by the leadership community when I applied sophomore year. I applied to be a leadership staff member and didn't get it my sophomore year. So I had to reapply my junior year and then got it again for my senior year. But you just have to recognize that even the best fit clubs, There will be setbacks, there will be obstacles, and that did not preclude me from having a wonderful 4-year experience here. Okay, next is UCLA Internal Medicine's My Life program. I was a health coach for this digital health platform. So My Life is a 16-week digital health program. We use some activity trackers, mobile messaging, data analytics, a lot of big words, to promote behavioral adjustments in patients at risk for lifestyle-related chronic diseases. We had a randomized control trial. We added some undergraduate health coaches compared to no health coaches and just the Fitbit by itself. And we assessed how they did with their nutrition and ultimately weight loss over 16 weeks. I was one of those health coaches, and I used motivational interviewing to troubleshoot obstacles precluding my patients from healthy living. So a lot of just kind of wordy jargon here, kind of hard to understand. But let's see what this story gives us. So Ben was my first patient. When he weighed 244 pounds, 70 over the upper bound of healthy for his height. He should have been 174 pounds max, healthy, right? He's 244. Over the next 2 hours, we developed an intimate trust, a trust that I'd accept his insecurities and respond with genuine interest in his success. And driven by disgust, he told me he didn't walk in the sun because he hated feeling sweaty. Actually, let me expand on that story. That was a shortened version, but really what he told me was that there came a time where he was walking out on the sidewalks in Los Angeles, and 2 attractive young women across the street were pointing and laughing at him because he was wearing a white shirt and had sweat through it. Kind of just struggling to get back home to get a change of shirt just so he could go back to work and not feel so sweaty and gross. He will always remember that scene, that scenario, that picture, the laugh, the sounds, the sights, the smells, the temperature that day, because it was just so emotionally jarring and embarrassing. It's stories like that that just show that we don't really understand what other people are going through, why people struggle with losing weight, until we get to know them, get to know their stories, why they're having these issues with their health, why they make the decisions that they do, until you really live their life. And so after growing and building a relationship with him, learning that story was really meaningful to me. One of my other colleagues worked with a patient who told him that the reason he wanted to lose so much weight is that he already had a heart attack. He barely got out of it alive, and his daughter was going to be married in the coming years, and he did not want his daughter to walk down the aisle with no father, right? Because he wasn't able to get in control of his heart health. It's stories like these that, again, just humanize people, make us understand the power of medicine, and just recognize the privilege we have to support these people. He lived a restrained life, and for my basketball injury, this was kind of referenced in another activity, I knew how he felt. Our collective understanding drove us together. For 4 months, 16 weeks, we worked hard. Wednesdays, he shot me pictures of his meals, and I told him what was good, what was bad, what we can do better. On Friday, we called each other for an hour, troubleshooting all the obstacles. Why couldn't we make it to the gym today? What was the issue with our nutrition this week? And we discussed some actionable goals going forward. I realized how ingrained habit can be, and consequently, I learned how to affect change. By developing discrepancy, essentially saying, this is what you want, but this is what you're doing. Can you see the difference? And between his lifestyle and his goals, I showed him what needed to change. He came up with it himself after I showed him the issues. I helped him associate watching Modern Family, the TV show, with concurrent rock climbing on his home machine. Instead of driving, he walked to work and then took an Uber home. By the 3rd week, he lost 6 pounds, and by the 10th week, he lost 10 pounds. Ben was always capable of reaching his health goals. He just needed someone to enable him. Because of Ben, I want to be a doctor, implementing motivational interviewing to enable patients to regain control over their own health. So again, this is just much better from a relatable perspective. This was kind of hard to connect to, but now you start getting a sense of like how well I know him. He watches Modern Family. When he drives to work, he feels hungry at night and doesn't have cooked dinner prepared, so instead he'll always hit the In-N-Out drive-through. He doesn't wear white when the sun is out because he doesn't want to sweat through his shirt and get laughed at again. There's this fantastic story of Larry Bird, who's an old basketball player who played with Magic Johnson, and how when he played in Boston, he would force while he was playing defense, he would force the people he was guarding to certain places on the gym because he knew that the planks there on the floor were old and rickety. And so if you bounced the ball on that plank, it wouldn't come all the way up. He would know that and go for the steal after forcing you to go over to that corner to dribble on that bad plank. It's these details and just the knowing of people, knowing of the gym, knowing of the game, knowing of the condition, knowing of what weight loss works and what doesn't work. Those details are just really what excite me about extracurricular activities or just about things that you get involved with in life. So I think if you can find something that you really, really enjoy learning more details about, that you enjoy studying and talking about, and you feel kind of emotionally tied to, those are good signs that those extracurricular activities will mean something for you. So I love this one just because I will always remember Ben. Ben was one of the first people that made me really, really feel kind of softened in my heart to recognize that I had been judging a lot of people for the decisions they made in their health without fully understanding the things that they were going through. If I had been laughed at by two young women across the street, who knows how I would see my own health and fitness and things like that. And so to Ben, I think a lot of how I see the world, and I want you guys to find extracurricular activities that also just change how you see people, change how you see the world, change how you see medicine. Those are all good signs of strong extracurricular activities that you can be involved with. This is one. Every year, over 50,000 pre-meds apply to medical school, and over 60% don't get into a single one. If this video hasn't been completely trashed thus far, I highly encourage you to take a look at the free resources we have in our description box below. Click the link in the description box to find out more, and for now, let's go back to the video. This is an extracurricular activity from a UCLA Premed who ended up at George Washington Medical School, another fantastic place to train. He ended up taking 0 gap years and was successful throughout his cycle. For this extracurricular activity, you'll see a bread and butter emergency medical technician. However, there's a little bit of twist that I want to share as I go over it. So last summer, I trained for 2 months at UCLA Center for Pre-Hospital Care to become an EMT. I learned to stabilize and transport patients to hospitals. After my classroom training was complete, I started to work for a private ambulance service where the training continues. I'm learning to be prompt without rushing, to speak clearly but softly, and to show respect and kindness at all times. The most important thing that I learned was how to remain in control of my emotions. As a new EMT, I was assigned to inter-facility transport, and I'll never forget one patient who I was transporting to a hospice facility. After her family made the decision to stop chemotherapy, she was extremely weak. Her cancer, together with her treatment, took a terrible toll, and it was painfully easy to lift her emaciated body onto the gurney. The patient needed oxygen and was in a lot of pain despite having been administered pain medications. Her younger sister rode in the back of the ambulance, and I wanted the sister to keep talking because I knew that it would comfort my patient to hear her sister's voices. We spoke about my patient's life and her favorite pastimes. I held her hand. When we dropped her off at the hospice facility, she smiled and whispered thank you. For several days after that trip, my thoughts returned to that patient and her family's suffering, conjuring very intense emotions that were difficult to cope with. Over time, experiences like that have led me to greatly mature as a person. After a lot of reflection and talking with my mentors, I understand that empathy and compassion are at the root of medicine, and my own emotional well-being and ability to self-care are vital to preserve my effectiveness as a medical provider. I've learned that no matter what situation I am faced with, striving to do my absolute best each time helps me achieve a sense of peace and purpose. So contextually, after we kind of delve into this beautiful writing experience, I want you to recognize that in the other extracurricular activities of this Premed, UCLA Premed's application, we have EMT volunteering, and then we have a personal statement that mentions him going to the emergency department after he has this really terrible hand accident that essentially sidelines and ends his football dreams and football career. Played football in high school, wanted to play in college, big hand injury, never plays again. Is an EMT volunteer actually at the same hospital that he services as a private EMT driver and technician. So I think that the context here that separates this from a classic EMT position is that he is involved and has been involved with emergency medicine, emergency care in a variety of ways. I think he writes somewhere else on his application that he's very familiar and comforted, and he feels like the emergency room is his home because he's been there and had so many life-defining moments in that place. And with that context, you start to really delve into this life-defining moment. I just love, again, the details, right? You can see this guy's personality. It's where the training continues, and I'm learning to give respect and kindness. I'm trying to be prompt without rushing, to speak clearly but softly. He seems like a very, very kind guy, and that's who he is, and it comes across in his writing. With that being said, some of these details I want you to pay attention to, because in your extracurricular activities, I'm confident that there are details that I want you to remember. It was painfully easy to lift her emaciated body onto the gurney, right? We have this 80, 70-pound old lady, very frail, very thin, and you're expecting to lift a human onto a gurney and wheel her away. And especially you're used to kind of these bigger people who have gunshot wounds and just feel ill and are vomiting everywhere and they're heavy. But this is almost like a paperweight. And that feeling is really only something that you experienced in your own palms, right? That's a person and a life in your hands. And I just love how he talks so kindly about the sister and comforting his patient. This is my favorite sentence in a while, and it's so simple. I held her hand. There's just a real beauty about how straightforward, how simple this is. Contextually, this really feels right? In the context of a woman who stops chemotherapy, is going to a hospice facility to live out the rest of her days in comfort. Just the purity of a sentence like that, I held her hand, is something that I want you guys to search for in your own extracurricular activities, where you find things and you find working with people in ways that are just infinitely personally meaningful to you, as you can tell it was for him. I even wrote this here, something so beautiful about how simple this is. And then the reflections, right? For every extracurricular activity that you are involved with from this point out, I want you to reflect. I want you to journal. I want you to write so you remember how these things made you feel. You can see here, he successfully invites the reader to his inner world and his conflicting emotions. You can read that for the past several days after the trip, his thoughts returned to that patient's and that family's suffering. You can imagine like he was thinking about how hard it was for that family to let their loved one go, and the conflicting joy that he feels because this woman is going to pass comfortably in a hospice facility, but also the pain of just learning about this patient's pastimes, her dreams, and then just seeing how much her family loves the patient, or that her family loves her, with the contrast and kind of the frailty of her weight in his hands, as well as her whispering thank you as if it's a goodbye. Those are all really beautiful contrasts that just help you understand how he's thinking about this. And I want you to share kind of how you're experiencing your extracurricular activities. What do you notice when you're working in research with mice? Like, do you notice something larger? Or when you're volunteering to support the homeless, or wash the feet of the local people at the homeless shelter, or when you are volunteering at a toy drive over Thanksgiving and seeing kind of the kids in different situations and just how happy they are to have a bit of plastic that rotates around and makes sound. Those reflections are things that we want to know about you, and I encourage you, when you look for your own extracurricular activities, to focus in and hone in on those things. These are 2 extracurriculars now from, 3 here, from 3 people, 2 here, who ended at UCI with a full ride, and then we'll close with an extracurricular activity from a fantastic UCLA Bruin who ended up at UC Riverside. So this is a chem undergraduate assistant. Again, I'm showing you these because Bruins or public school kids, you will recognize that these are very commonplace extracurricular activities that you have certainly heard of, if not are in yourself right now. And I want to show you how people are writing about it, how people are experiencing it, so you can compare and contrast your own experience with theirs. Chem UA, I led weekly peer learning sessions with about 50 students in attendance. During these sessions, I reviewed self-developed worksheets to teach the students important concepts and problem-solving skills. While my sessions were only 2 hours, I often stayed an extra third hour to answer questions and cover all the material. Before midterms and finals, I also did review sessions for hundreds of students. We're talking 200, 300, 400 students. General chemistry was the first STEM class in university for many of my students who often felt intimidated by the complexity of the material. Forming long-term connections with students, providing them guidance as UA, fueled my passion for education, mentoring others. So this first paragraph is pretty straightforward, right? Except the numbers really paint the picture. 50 students in attendance, having that extra hour and staying to answer all the questions, doing review sessions for 300 students who had attended, right? If you are a UA at UCLA, Berkeley, San Diego, the only reason, I just want to share this, the only reason that this particular student who's now at a UCI with a full ride ends up servicing and supporting 300 total students is because he's dang good at his job. He is really good at reviewing general chemistry. Every one of his sessions has 50 students in attendance. Some lectures at UCLA can't even get 50 students to show up, and this guy, as an undergraduate senior or junior, is able to teach over 300 students right before a very important midterm for most of these college students. If you are deciding to be a UA because you want to get into medical school, I want you to recognize and remember that people are becoming UAs because they really like it and they're dang good at it. And so if you're just doing it to do it and go through the motions, it's going to pale in comparison to someone who is this good at teaching and just is that good because he likes teaching, he's doing it for himself, he's doing it because he enjoys passing on that knowledge. And what that means for you is if this is not your thing, it doesn't have to be your thing. You can move on to something else where you might be the best volunteer arts director at the hospital, able to partner with 2-3 dozen kids and create an entire gallery of artwork that paints the children's wards, right? I guarantee you this student would not have been able to do that because that's not their interest, whereas maybe you are really interested in that. That is where you are world class, and that is where you should make your impact. And so remember, just because someone is a UA and gets into UCI full ride doesn't mean that you should be a UA. He gets into UCI full ride because he's a dang good UA, and this shows you how exactly, or why exactly, gives you proof of that. I could barely see the back row of students packed like sardines in the lecture hall. Over 300 students had attended the review session I was hosting before the first midterm of the quarter. It was daunting, staring into the audience, knowing that I had never taught this many students at once before. I took a deep breath to relax and started reviewing a stoichiometry problem. As I wrote the solution underneath the document camera, my hand trembled. As the session progressed, however, my confidence grew with each solution explained and each student's question answered. Let me move my head here so that you guys can see. All right, head is out of there. At the end of the session, many students spoke to me about how the review session gave them confidence to do well on that midterm. From my first review session to my last, it was rewarding to motivate students to learn. Through teaching, I also became more cognizant of diverse educational backgrounds. While some students had prior exposure to college chemistry, many did not. It was especially fulfilling to create a supportive environment. I hope to carry the appreciation for diversity and inclusion I gained as a UA into a career in medicine. Again, the details of how he's writing the solution, his hand is trembling under the camera, that's just something that only he feels. I guarantee you those 300 students who were there for review didn't notice that. They were just focused on getting the question right and making sure that they were doing well on their final. But this is something he notices. Just that anxiety and that responsibility of caring for 300 students and their learning. But again, I just want to stress even the most common extracurricular activities, from being a chemistry UA to being an EMT, that stuff really stands out when you are good. And you are only good when you really, really care. Okay, let's move on to the next extracurricular activity from the same UCLA Bruin Premed. In the blank lab, I aim to investigate secreted vascular guidance factors plays in angiogenesis after ischemic injuries such as myocardial infarction. My independent research focused on evaluating changes in vascular guidance factors in cardiac fibroblasts following pathological stress in mouse models using cell culture, PCR, immunohistochemistry. I also led discussions about recently published cardiovascular biology papers during bi-weekly journal clubs. My involvement in research fostered my curiosity to more fully understand biological processes and contribute to knowledge that will advance the science of medicine. Okay, pretty much a standard research experience that I imagine most UCLA premeds have involved with, right? You might not be doing secreted vascular guidance factors in cardiac fibroblasts, but you're doing something that's basic sciencey, clinical sciencey. So let's see what really stood out here. Looking under the microscope amplified the shakiness of my hands as I failed to insert the cannula or the tube into the incision in the mouth's or the cut in the mouth's abdominal aorta, essentially the vessel in your stomach area, connects to your heart. I turned to my graduate student mentor who advised me to hold the incision open with my tweezers. So hold the cut open with my tweezers and align the tube more parallel with the vessel, the artery. Heeding his advice, I attempted the insertion again. I knew I'd successfully performed the maneuver when I saw a flashback of blood into the cannula. So essentially when the tube filled with blood. As I pushed saline or salt through the tube to retroperfuse the heart. So now that I have a tube connected to an artery, which is connected to the heart, I can push salt and it will push salt into the heart. I could see the coronary arteries began to blanch as the solution replaced the blood. So I essentially pushed salt through the heart and that salt replaced the blood. Excited by my progress, I continued practicing the technique for the rest of the day. Conducting research further cultivates my fascination for learning the intricacies of anatomy and physiology. So a lot of people will say that they love anatomy and physiology, but this is a real example of him literally manipulating anatomy by pushing salt water and changing the physiology of that heart by replacing all the blood with salt. Research allows me to apply the knowledge I've learned in my classroom to explore unanswered questions in progressive medicine through innovation, success and failure. Research also drives me to think critically, troubleshoot, improve. Okay, fine. So again, I just love how unbelievable some of these details are. That story about putting a tube into a mouse's artery, pushing salt and perfusing the heart in a backwards fashion just really shows how much trust that his lab has in him. And again, everyone can be involved with research, but this is what high quality world-class research looks like. It looks like presenting about papers during your biweekly journal clubs. How many of you are in a journal club where you don't say anything, you don't answer any questions, you never present? And how many of you are actively involved, engaged at the level of a graduate student, doing your own procedures, doing your own experiments, going into the journal clubs with papers that you've read that you want to present to the lab, right? You don't have to be as smart or as accomplished as your PI, your graduate student, your postdoc, and you won't because they have way more experience than you. However, if you want to progress, if you want that strong letter of recommendation, that impressive extracurricular activity, you have to act like you're the next level. You have to act and operate like you're a graduate student who's been in the lab for 2 years, not just 1 year. And how do you do that? Journal clubs, asking for independence, doing your work early and in advance, posing things or noticing things during experiments that you want to fix or talk to your graduate student mentors about, things of this sort. And I just think this story gives a great experience for all UCLA premeds, all premeds across the country about what strong research looks like. It has nothing to do with publications, nothing to do with poster presentations, but I guarantee you, if you operate at this level, you will get publications, you will get poster presentations, you will get strong letters of recommendations, just because you're much more engaged and involved. All right, let's wrap up here with one of my favorite extracurriculars of all time, a peer mental health coach for another UCLA Bruin Premed who ended up at UCR Riverside. As a peer mental health coach, I provided free cognitive behavioral therapy based support sessions to my peers with mild to moderate depression and anxiety. In my year-long intensive training program, I attended support groups, conducted role plays with review by a clinical psychologist, and led mock support groups. As an experienced peer mental health coach in my 3rd and 4th years in the program, I took initiative to plan, coordinate support groups, as well as provide constructive criticism to coaches in training. I had to apply my skills of open-ended questioning, motivational interviewing, and providing validation to provide compassionate care as a physician. So notice, in my 3rd and 4th years in the program, in my year-long intensive training program, she doesn't earn this leadership position after 1 quarter because there was no one else to do the volunteer director position in the club where you only have 4 people, right? No, she did a year-long training program. She's been here for 4 years, and that's how she earned the expertise and their leadership position to coordinate support groups, plan them, provide constructive criticism to new coaches. It takes time to develop really good, strong things, and this is a great example of that. As a peer mental health coach, I strove to learn about and provide trauma-informed and culturally sensitive peer support. While coaching a participant with mild anxiety, she discussed her desire to contact her estranged father for it, explaining the family-oriented nature of the festival and the importance of respecting elders in her Turkish culture. I asked open-ended questions to both better understand the participant's conflict and guide her in her core feared outcome, rejection for her father. We then made a step-by-step plan using cognitive behavioral therapy exercise of exposing her to reduce her anxiety and increase her confidence while meeting her father in person on it. As a facilitator, I realized that posing broad questions and providing appropriate validation allowed my participant to feel comfortable and discuss her perspective with me. I was humbled to share a vulnerable space and work through an intimate conflict. Motivates me to pursue a career when I can continue assisting those coping with physical and mental health challenges. Okay, so it's super relatable, right? You can relate to this experience much more through this Turkish peer. We have all had friends who have had trouble with their parents or who have had things go awry in their friendships and things of that sort. It's very human. And again, the thing I want to highlight in this extracurricular experience is that she doesn't earn the opportunity to work with this student right away. No, this is a whole year of training. This is a lot of support groups, working with a clinical psychologist. This is developing those skills to listen actively, actually take what she hears, ask appropriate questions to move the conversation forward, to break down the fear in a scientific, psychologically validated way. And her reward for that is really making a difference. You don't get to make a difference if you don't have the skills to make a difference. You don't get the skills to make a difference genetically. You don't get them just out of the box. You have to work at them and work at them and work at them and train over 3 or 4 years. And so if there is something that you do care about and you want to recognize and make an impact and earn leadership positions in them, I hate to say it, but it is hard. It is hard to get good at things. And the easiest way or the fastest way or the best way, I should say, to do that is to, over time, work at it. Over time, choose things that you can continue to last and train through because you like it so much. And if you can last for 3 or 4 years, then you will build the skills to make a real difference in a real person's life, like this person did with that Turkish student. You need to apply this framework to those extracurriculars that you are involved with. If there are things that you don't think you can do for 2 or 3 or 4 more years because they're just not in alignment with your interests, ask yourself, why are you in this anyway, right now? Because by saying yes to that extracurricular activity that is uninspiring for you, you are saying no to another extracurricular activity that would be better and stronger and more appropriate for you. You are saying no to developing and training the skill set that will be required to make an impact in that other activity. You are saying no to those things. So I hope this extracurricular activity inspires you to take a look and reflect on the things that you are currently involved with and make sure that you are choosing things that give you the bandwidth to grow over 3-4 years. Okay, so those are my 4 favorite extracurricular activities, or not 4, 7 favorite extracurricular activities that got students into schools like UCLA, UCSD, UCI, and UCR. We had everything from patients losing weight with me in my life to the clinical research with the student stroke team to Vietnamese Community Health, a club that anyone can join, to how he remixed emergency medical technicians, or EMT, to be specific to his journey in his life and the details of that emaciated grandma who was going to hospice. We have a student who just does your run-of-the-mill undergraduate assistant in general chemistry, but does it to a world-class level with 300 students. And does research, again, just like all of us, but in a way, in a graduate student level with high levels of involvement, with a beautiful detailed story of how he's engaged with the anatomy and physiology of mice and their hearts, and wraps up with one of my favorite extracurriculars, the servicing of the student community by being a peer mental health coach that only happens after years and years and years and years, 4 of them, of training to be an appropriately skilled coach to support a fellow student. Bruins or public schools or UCLA Premeds, UC San Diego, UCI, UC Berkeley, or any really pre-med across the nation, I hope that these extracurricular activities inspire you as options for how you can take public school offerings, real ones that were alive and well at UCLA just this year and continue to be available at UCLA for you to join. I hope you learned what makes some of these stand out and how you can apply some of these learnings to the extracurriculars in your own interests and apply them to your overall pre-med journey. Thanks, and hopefully this was helpful. If you found these extracurricular activities helpful, you'll want to see the entire application that these pre-meds submitted. Everything from their GPA to their MCAT and their personal statement, so that you get a full picture of who they are. You can find over 7 full medical school applications on our application database, link in the description below. These are my favorite 7 UCLA pre-med extracurricular activities. Hopefully you found one that was inspiring and something you feel like you could also do yourself. Now, if you're looking for more inspiration, I've probably read more than 500 extracurricular activities, and in this video, I share my favorite ones. If you're looking to stand out to medical schools, make sure that your extracurricular activities stand out, just like these did here. I'll see you in that video there, and thank you again for watching this video.